Now, it's one of my favourite times of the month. We're going to be chatting to Dr. David Deardon, and today's subject is Alzheimer's and dementia. Delighted to welcome you back, Dr. David.
How are you, young Selina? It's lovely to speak to you on this cool, cold, but bright summer, winter day. Lovely.
You know what? You're not going to believe this, but I've got the air conditioning on in the studio.
No. I've got the heater on.
You have not. It gets so warm in here.
Very cold.
Well, it is. I must admit, it is cold outside, but it gets warm in. Well, you know what it's like in here. It gets warm because of all the equipment. So well, yeah, but the trouble is, poor Hannah, because she comes on after me at 4, so I have to whack it right down and put the heating on because she gets cold. So I get hot, she gets cold. We have to try and please everybody.
Absolutely. Speak to the boss.
Yes, exactly. Right, so we are talking about Alzheimer's stroke dementia. Now, this is one thing that I think confuses people. It certainly does me, because Alzheimer's and dementia seem like one disease and a very similar disease. But am I correct in thinking that dementia is the umbrella term?
Well, yeah. So you're absolutely correct. Dementia is a term that we use to describe a series of conditions that we observe in people. But the causes of those conditions are multifactorial. So you're absolutely right in what you say. It's an umbrella term. It's a descriptive term, but there are many different types of dementia. It's a bit like saying infection, but there are lots of different types of infection.
Right.
So, appendicitis is an infection, pneumonia is an infection, meningitis is an infection. They're all infections. So dementias are basically, they describe a series of symptoms where the cognitive function, the thinking, the remembering, and the reasoning of the brain is impaired. But it can be caused by a variety of conditions which are being. We're finding more and more ways of describing it. So obviously the common one we talk about is Alzheimer's, but there are a variety of conditions which seem to have specific characteristics which group them into some broad descriptive or some broad areas. But the symptoms are often the same or they overlap. So you might describe someone as having dementia, but it could be caused by one or two or three, or one of a number of different conditions which are described by the pathologists and the doctors who deal with this in different ways.
So is Alzheimer's the most common one? Because that's the one we normally associate with, isn't it?
Yeah, Alzheimer's occurs in probably of all dementias, about 60 to 70% of them are described or fall into the Alzheimer's description. And this is really where the symptoms are people who have problems with short-term memory or possibly finding words, or possibly people who have this what we call visuospatial disorientation, people who get lost, or reasoning, judgment, and various other things like that. They become not so well refined, and so that's the sort of the way that Alzheimer's tends to present. And the most common part of the brain that's affected by this is something called the hippocampus, which is in the middle of the brain, which gets smaller and shrinks, and therefore doesn't work so well.
And you mentioned what's happening is the brain is impaired, which makes sense. Is this due to wear and tear? Is it an age thing?
No, it's not. You see, this isn't a natural part of aging. This is a pathology. So this is where the brain is becomes diseased. And in the Alzheimer's situation, you get plaques of something called amyloid, which is a type of protein which collects around the nerves and stops them from working so well and makes the brain shrink. There's a condition called amyloidosis, which occurs in the other organs in the body and can damage those, and the liver and the kidneys and so on and so forth. But in the brain, you can get these amyloid deposits, which cause sort of a degree of inflammation in the brain around the nerves, and it's the repairing the response to the inflammation that damages the nerves. So it's not an aging process. This is very much a pathology.
So why would somebody get it? Would it be genetic, or it can be other reasons?
That's the big problem. We don't really know. There are some types of dementias that can run in families, but there doesn't seem to be a firm genetic link. And if you look at the other forms of dementia, if we were going to look at them broadly speaking, there's people, and people may have heard about vascular dementia, which occurs is sort of another 20% of dementia patients have vascular dementia, where the blood supply to the brain is impaired, either by little clots of blood blocking bits, so mini strokes, or impaired blood supply, or temporary impaired blood supply, where the brain doesn't receive blood for a period of time, or the blood supply gets completely blocked off, and then the brain behind that blockage dies or becomes less able to function. But there are other rarer conditions, things like something called frontotemporal dementia. That tends to occur in younger people, less than 60. And that's associated with not amyloid, but different proteins that get deposited in the brain, and they seem to have a similar effect. But they tend to occur around the frontal lobe, which is the lobe that's responsible for your personality and your character. So that has an effect really on your personality and character, not so much on your memory. On your memory and on your getting lost and your visual spatial awareness.
Right.
So depending where the condition occurs will tend to give you the symptoms. Vascular dementia can occur all over the brain, so you get a whole variety of problems, weaknesses, or personality changes. But as I say, it depends on where the blood vessels that are being affected actually supply. And there's another type of dementia. I mean, there's lots of different types being found. So there's Lewy body dementia, which is again caused by a different protein, not amyloid, not the tau protein seen in frontotemporal dementia, but these Lewy bodies are a different form of protein which were discovered by a guy called Louis, as you would expect, and that again is a type of dementia that affects sleeping and the ability to sleep. So these are all specifically recognised syndromes which seem to be caused by different pathologies, but the end result is that people have this what we call a dementia, where we do tend to get a variety of symptoms based around memory loss, inability to function normally, withdrawn personalities, etc. And the balance is, depending on what type you've got, what the more common symptoms the patient will actually demonstrate.
Yeah.
So it's very, very broad, very wide covering, and it's not specific, so it can be quite difficult to pick up in the early stages.
Yeah, I interviewed a lady the other day. Her mum sadly had dementia. I think she had Alzheimer's, yeah. And her main thing, as well as memory loss, was that she became paranoid, and she thought that somebody was living upstairs and all sorts of other things. So I suppose that all depends where in the brain it is, like you've just explained, as to why she's like that.
Yes, well, I think because the Alzheimer's tends to occur in this area of the brain called the hippocampus, and in the sort of the temporal, the parietal lobes. That's the area that sort of deals with reasoning. So people might start to have impaired judgment, and that in turn could lead to the paranoia. You'll become unreasonable in your explanation for things you're seeing. And therefore, as a consequence, that could lead as a demonstration of what it would present as a degree of paranoia. But what's going on is the brain isn't able to actually link what it's seeing and what it's hearing with its interpretation of that input. Did you follow?
Yes, I do. I'm just reading. We've had WhatsApp in for you from Mary in Malaga. She said, please can you ask Dr. David, do lifestyle factors and conditions associated with cardiovascular disease cause Alzheimer's?
Well, the short answer to that is yes. The longer answer is obviously more the vascular dementia. So the dementias that are caused by blood vessels getting blocked. That tends to occur in people who have more generalized vascular disease. And of course, things like high blood pressure, high cholesterol, cardiac problems, irregular heart beating, smoking, of course, those type of conditions, those type of lifestyle choices tend to increase the risk of vascular disease, and ergo is associated with a higher instance of vascular dementia. With the other types of dementia, Alzheimer's and Lewy body and so on, frontotemporal, the lifestyle association with cardiovascular disease isn't so strong, probably not there at all. But we don't know really what causes these other types of dementia. It's not fully understood, but certainly the vascular group, which is about 20% of dementias, is certainly linked to lifestyle and cardiovascular lifestyle risk.
Okay. Hopefully that helped, Mary. And you mentioned, David, about it can't be, it's sometimes not very easy to diagnose. I mean, we all forget things every now and again. It's when it gets to the next level, I'm guessing. So if we did go to see the GP, what would he do? Would he have to do a brain scan?
Well, every time I forget, my daughter's name or something, I start thinking, oh my God, what's wrong with me? But I think it's probably just, the way it is. You forget things every day in your life, don't you? And you've got to separate that from, progressive disease. So when you go and see your doctor, they will probably take a very close history. They will maybe do some basic tests, and then what they might do is refer you to a memory clinic or some kind of clinic that specializes in this type of disease. I mean, some people do present, and you can scan them early on, and you may see some atrophy, some shrinking of the brain tissue. But that wouldn't really be the first line of investigation. The first line would really be more parametric sort of tests of memory and sort of memory cognitive type function. And then if that was suggesting something, then they may go on to do some other tests, which might include scans. But the way it's really managed is more outpatient based assessment with specialist personnel, doctors and nurses who are skilled in asking questions and observing responses and observing behaviours.
Yeah. Is it treatable or is it just manageable?
Well, sadly, there's no cure. That's the terrible thing about the condition, is that, obviously with something like vascular disease, you might be able to slow the progress if you reverse a lot of or you stabilise a lot of the underlying pathology. But the rest of it, as we don't know what causes it, it's very difficult to treat. So one has to try and just slow down the progress and try and improve and optimize life as much as you can, but by exercising the brain and trying to get people to engage in exercises that try and keep the brain function that's there going. But sadly, there is no treatment.
Very sad.
Other than managing. Well, there are medications that people can use, but it's really to slow progress rather than reverse it.
Very difficult choice. I know my parents, who are both in their 80s, they do crosswords and things every day. Does that really help?
I think there's evidence that certainly keeping the brain functioning is good. But if you've got these conditions, then you're not going to stop having the protein deposits in the brain, and therefore it's not that if you've got dementia, then it's not going to help stop you having dementia. But I think by keeping the brain that you've got functioning well, I think it builds up a resilience so that if you do start to get dementia problems, then you may not deteriorate as quickly as others. You know?
And can it be prevented? I mean, is it just about living a healthy lifestyle?
I wish I knew the answer to that. I think these proteins that are deposited in the brain have to come from somewhere. I don't think there's any research that's really accepted in the literature that actually say you can prevent it. I think certainly from the point of view of the vascular problems, yes, I think you can probably limit that or slow that by adopting a healthy lifestyle, which one would recognise as being the same lifestyle choices as you would take for someone who had vascular disease generally. But other than that, no. And when you look at the laboratory tests that one can do when someone's looking to see if there's anything underlying the problem, we would look at kidney function and liver function, inflammatory problems, because you can have underlying pathology that might give dementia type symptoms, which might be reversible. But if you've got the amyloid or the Lewy bodies or the proteins being deposited in the brain, I think that's much more difficult to determine what's causing that. We'll know in the future at some stage, I'm sure, but as of 2023, we don't really have any quick answers to that.
Okay. An email and a WhatsApp's come in, so let me just move a little closer so I can read this one. This is from Annie. She said, "Hi Selina, would you mind asking the good doctor, please confirm that somebody suffering from Alzheimer's is not aware of what's happening to them?" I suppose that's a difficult one. It all depends what stage, doesn't it?
I sadly, I don't think I can really confirm that. I think I don't know the answer to that question, I must say. I think that I think some people possibly are aware of what's going on. Maybe others who are more severely affected probably don't. But early on, I think if people are beginning to become forgetful, people are aware that they're becoming forgetful. They may not necessarily recognise that this is a form of dementia. And there comes a point where people are, their awareness is probably impaired to a level where they're not aware. But I think there's a middle ground where I think it's probably very difficult for anybody to really say. And I suspect that some patients do sort of become aware that things aren't quite as good as they were. So I'm really sorry. I can't answer that with any honesty and say no. I can say people who are very badly affected probably aren't aware of what's going on. But in that middle ground or in those early phases, I think people possibly are. And obviously, in many cases, I guess people are very frightened and don't talk about it.
I'm sure there must be. I mean, I know that there is like the Alzheimer's Society and things, but I would imagine they're good websites to go to for advice, because I often think, should you say, if they forget something and they ask the question again, like, is somebody still alive, for example, is it easier to lie to them so that you haven't got to keep saying, yes, somebody's died, and then they get upset? It's difficult to know how to deal with it, isn't it?
Well, I think you're absolutely right. I think everybody will deal with it differently, and I think the problem is that people will have moments of lucidity, and they'll have moments of forgetfulness, and so therefore, if you tell a lie, it's very difficult to maintain the lie. So I think everybody has to make a personal judgment on that and decide themselves how they want to deal with a loved one or a relative or a patient that is going through the process. I think honesty always is the best way forward, but it can be quite trying on carers who are dealing with someone who is deteriorating, particularly if it's a partner or a parent or somebody where the same questions are being asked and the same things are being discussed and the same issues are coming up time and time again. So I think everybody has to make a decision on their own merit about how they feel, how comfortable they feel about various ways of doing it.
Yeah, good point. Well, sadly, we're out of time, but we will chat again next month. Just let us know how it's all going. I believe the clinic is coming on in Gibraltar.
Yes, it's made a great jump forward this last couple of months. We have our big MRI machine is arriving, I'm told, next week. So that's going to be very exciting. And then once that's done, we will be able to offer people in Gibraltar the scans in Gibraltar. That up until now, the scans have all had, MRI scans have all had to go to Spain to be done. So we will be actually sort of repatriating that service for many of our patients, which will be very good. And yes, my headache and my sleepless nights continue. My good wife continues to put up with me and
good old Sophie.
Which means I must be doing something right, and life goes on. But at the moment, we're working flat out, and the whole team are doing a great job. But it's very stressful and very, very time consuming, and I'll be very pleased when it's all done.
It'll all be worth it. Honest. I'm sure you will, but it'll be worth it. Yeah.
Well, it will be, of course, it will be, because I think we'll be offering people on the southern end of in the Costa who are looking for healthcare from an English speaking type institution. We'll be able to offer them something a little bit different to what's being not different from a qualities point of view, but the fact that we will be offering a service in English based on the English system, on the British system, should I say, not English, I'm very sorry, on the British system. I think that will give a lot of expats up the coast some comfort. I know myself going into hospitals as a patient, I did that year before last when I had my back done. Even though my Spanish is I understand medical Spanish, I would say. I wouldn't say my Spanish is good at all, but certainly medical Spanish I understand a little bit more than normal Spanish. And I found it quite a difficult experience, even as a medic, to go into a hospital and have an operation. And it's nothing to do with the quality of the doctors. It's just the familiarity and so on. So we'll be able to offer a little bit more of a sort of a home style service here, which I think some patients may find valuable. Great stuff. And just remind us of your website. People can find out more. Well, the clinic website is www.smc, specialistmedicalclinic.gi, but the hospital now has a website. It's a holding page, but it's called gibmed.gi, www.gibmed.gi. It's a website just showing what's coming. And each sort of page will be populated over the next few months as we start to open services in the hospital part of the clinic. So it's a busy time. Marvelous. Exciting time. It is an exciting time. Well done. I look forward to seeing it, and I look forward to speaking to you again. I was going to say in February, but it'll be in March, won't it? We're in February now. We're in February already. We're halfway through. Oh, my God, it'll be Christmas soon. Well, actually, I know. Don't say that. Then I'll be another year older. That'd be terrible. Yeah, won't we all? Lovely to chat to you, David, as always. Thanks, Selina. You too. All the best to everybody listening. Thanks for listening. Thank you. Bye-bye.